Welcome to Business Line's State of the Economy podcast, where you'll find insight, analysis, and the story behind the numbers.
Hello, and welcome to Business Line's State of the Economy podcast. I'm your host, Sanjana, the publication's tech reporter. Generative AI is set to transform healthcare by improving patient outcomes, streamlining clinical workflows, and enhancing the overall quality of care. It has several applications in the field, from medical imaging to predictive analysis, all of which can save both time and money. Shez Partovi, the Chief Innovation and Strategy Officer and Chief Business Leader of Enterprise Informatics at Royal Philips, will talk about combining software and hardware solutions to help healthcare leaders and care providers with actionable insights they need to deliver high quality care and improve patient outcomes. Thank you for joining us today, Shez.
Thank you for having me.
So, I think we can get started. So, perhaps you could start by telling me how Philips is integrating Gen AI in healthcare and what specific applications are being explored.
First, it's just a delight to be here in India. It's as you know, Philips has been here in India now for like 96 years, so it's phenomenal to be back, and I love coming here. And thank you for taking time to connect with me today. You know, when we look at generative AI, one of the areas in which we see an opportunity for generative AI to help is around the patient literacy. So around the world, patients don't always understand their medical records. In fact, there's a study that about 50 to 60% of individuals aren't able to really understand what their medical records say. And actually, when you consider, for example, India, with all the dialects, it's even sometimes more challenging. So Philips, one of the things that we're doing, we have a product that's an electronic medical record. And in that product, what we're doing is we're embedding generative AI so that when patients want to look at their chart, it actually converts that complex medical language into simpler language that can be understood easier. Part of that team is actually based here in Bangalore. The product itself is not in India, but the team that's working on that technology is actually right here in this building that you're sitting in. So but that closing of the health literacy gap. Someday, there are many parts of the world that patients will log on to a website to look at their medical records. Pretty soon, you're just going to have a conversation with your medical record. You'll just be talking to it or texting it. Why did the doctor order the MRI? And it will talk back to you in your language, in a level of understanding that you understand, and explain why the doctor ordered an MRI. And so this idea of being able to close the literacy gap to help people care for themselves better is one of the most potent things that generative AI can do for patients. We can talk about doctors in a second. But for patients, it's an incredibly empowering opportunity. And so we're doing that as well as we're doing it, actually, quite frankly, with some of the great talent that's right here in this building.
Thanks. So how does generative AI enhance patient understanding? And I think you also mentioned that, there's the part where you also have to provide solutions to doctors. And what impact does this have on healthcare outcomes?
So there have been many studies done. Let's stick with patients first, then we'll go to doctors. So patients, there have been many studies done globally that shows that when individuals understand their own condition, the health outcomes are better. There's nothing as potent as empowering an individual with an understanding of their condition. So from a perspective of health outcomes, closing a literacy gap anywhere in the world is been established through research to show that it improves outcomes. Now let's look at physicians. Let's look at nurses. So a great example of that is when you look globally, physicians are overwhelmed, overworked, and overloaded. There's so much data that's coming at them, both physicians and nurses. And they have to look through all this data for key things that are important so that when they're going to come see you and talk to you, they have an understanding of your medical record, and then they come speak with you, they understand how you're doing, and then they make a decision, what test order to what medication to give. Generative AI has an ability to look at your past records and then provide a summary. So and in fact, we do this again in that same electronic medical record I mentioned. It's called TASI. The physicians are able to get a summary of those records in a nice little sort of a brief And that brings all the most important things forward. And then when the physician or the nurse talks to the patient, they have a quick way of getting all that summary so they can actually deliver better care and actually also reduces the amount of time needed for each patient. So because that summary is provided, so they can see more patients. Because the reality is there's just there's shortage of staff across the world of physicians and nurses. So this allows more care to more people, better care to more people. That's really one of our missions, anyways, to help deliver better care to more people across the world. So that allows us. That's where generative AI really plays. And now we can talk about also non-generative AI, so the neural networks, and there's incredible potential there. But if we're staying with generative AI, those are two areas in which both for nurses, physicians, and for patients, it's incredibly empowering.
And what are some recent technology developments in India that physics is excited about?
Oh, there are some amazing things happening. So look, let me tell you one example which has hardware, software, and AI in it. So when there's a mobile, in order to back up. So when you want to care for patients in the hospital, they can't always go to a room where there's an X-ray machine. Sometimes you want to take the X-ray machine to where the patient is. So if the patient is really sick in a room, you can't take them to the X-ray machine. You bring this mobile. It's called a mobile CR, and our mobile CR is called generative. And in that hardware-software combination, first, the hardware is manufactured in Pune.
Okay.
The software for that is actually written here in Bangalore. So you have a perfect example of a mobile CR, which actually goes to the bedside, where that technology is right here done in India. It's manufactured here in India. The software is built in here, and it's actually delivered to about 100 countries all over the world from India. So this is an example of in which we have technology that's manufactured here, software that's built here. And then there's one more thing. I mentioned AI. So when you take this mobile X-ray, the CR, to the bedside, the physicians want to be able to see everything as clearly as possible. And some of the AI technology is developed so that they can see the catheters, the stents that might be putting in the patient. That technology, that AI technology, is also developed here. So now you have AI, software, hardware, all done in India, delivered to 100 countries throughout the world. That's probably one of the most exciting things of Philips's sort of great innovation that comes from India, goes to the world, is that mobile CR that we have. And we have so much technology beyond that as well I can talk about, but that's one of the ones that I'm really excited about.
Okay. And how is Philips as a company contributing to the growth of healthcare technology ecosystem in India?
One of the things, so Philips, the way in which we innovate is by closely partnering with health systems and institutions. And so in India, the innovation mechanism that we do is a similar way. So we partner with health systems and organizations like Manipal and Naranya. And I'll give you an example of each of those. So, for example, we have AI-based technologies embedded in our MRI scanners. And it's through the partnership with Manipal that we've built that technology. So part of the contribution is, first of all, it's contribution because we bring the technology know-how, we bring the engineers, we bring the software, we work together with the clinical partners here in India to develop technologies. That also helps raise both the competencies of individuals here, but also for those health systems that we work with, it also allows them to be on the cutting edge. And so that becomes a center of attraction to attracting talent. So those health systems are very excited about partnering because they've shown that when they're partnering with the technology company, they attract talent to come work at their site as well. So whether it's Manipal, whether it's Naranya, whether it's an MRI, whether it's in CT, whether it's in hardware, whether it's in AI, we both benefit because we built technology that is good for India, good for the world, but also benefits by bringing that know-how, that expertise to the health systems, to those hospitals, so they can deliver better care for more people, but also attract great talent that would be working with those hospitals. So that's one example. We also do all kinds of education programs. In fact, when you look at the work we did with Naranya, it's also it's around there's a program we put in to train the cardiologist to doing echocardiography. And so we put together a program that trained about 200 specialists on how to do scanning of the heart.
Okay.
And also on that, we did about 136 different modules of programs. So it's also around education and raising the bar of skill here and developing that competency within the community in India as well. So whether it's care delivery, whether it's technology innovation, whether it's generally knowledge of individuals in local communities, like I said, we've been here 96 years. We'll be here another 96. This is really an important local community for us. Globally, we do a lot of work here that goes globally. So we'll continue to invest here in that way as well.
And what are the benefits that strategic partnerships, like you mentioned, Narayana and Manipal, what do these partnerships bring to Philips and the healthcare industry in India?
Yeah, when you look at the diffusion of innovation in any area, like in India, partnering with health organizations allows for that diffusion to happen. And by the way, the partnership is not simply with hospitals, but also with public agencies as well. And so this collaborative work that we focus on, because for us, it's not about just bringing technology to an area. It's around understanding the local needs, because healthcare is local. Healthcare is delivered differently in every area. So understanding the local healthcare community, the local healthcare needs, and then working collaboratively to innovate to solve the local healthcare problems allows for that diffusion of knowledge, diffusion of expertise, diffusion of skill, so that there is better care for more people within India. So that is one of the ways in which the work we do with these partners allows for the diffusion of that clinical excellence and technology innovation throughout the community, wherever it is, but also throughout India.
And what are some challenges that Philips face in implementing Gen AI in healthcare?
Well, the challenges of implementing generative AI actually are probably the same everywhere in the world. So we face it here in India, but it's really no different than anywhere else. And it starts with that in order to build AI models, you really need data. And so one of the general challenges, and it's no different in India, is first partnering with organizations because the data belongs to the health systems, to the hospitals. It's not our data. We work with our partners that I just shared. So one of the challenges that you want to be able to create partnerships that provide access to data. We, of course, de-identify data because we don't know who the patients are. We de-identify the data and then build them all. So first is actually one of the challenges getting access to data together with our partners to build those models. And then to ensure that, of course, the next thing is to ensure the models are accurate and they don't have what's called bias. And so to do that, what you want to make sure you do is you have access together with your partner to a large variety of data and a large volume of data. So the challenge there is to build great models. You want lots of data, and data of different variety, and then to make sure it's secure, make sure it's de-identified. And when you do all that, then you can build models that can deliver sort of the insights that are needed. So those challenges, quite frankly, are everywhere in the world, and so they are here in India as well.
And how do you envision the future of healthcare in India, and what role does technology play in this?
I think there's a huge opportunity unfolding really in India. When you look, there was a study done by BCG, actually, that Boston Consulting Group, that talks about the expected tenfold increase in digital health in India by 2030. I mean, what a fantastic time to be looking at how to innovate in healthcare in India when you're at the precipice of taking off in terms of the opportunities of delivering better care for more people. So we see an incredible time over the next decade in India where the opportunities of bringing technology so that you can disperse and have access to more care throughout India is an incredible time and opportunity. So for us, we see this as a time where we want to partner with organizations, with hospitals, partner with public agencies here in India so that we can help bring that technology and elevate, if you will, the entire industry within, quite frankly, within the whole region, but also in particular in India. I think that translates itself into a few things. One, that you can bring a lot better care to a lot greater numbers, because access to care is an area of focus for us. One of the things that Philips is quite proud of is our focus on improving the health and well-being of individuals through innovation. We have our own goal objectives that we want to improve the health and well-being of 2.5 billion people every year by 2030, of which 400 million people should be in underserved communities. And so our own mandate aligns with where I think the growth in India is happening. And so for us, we see this as a great coming together of both the great innovations that come from India for India and our mission of improving the health and well-being of individuals and delivering better care for more people. So these two come together in a beautiful way in India. And so that's why we, of course, continue to expand our presence here. That's why we expanded this Bangalore site to 650,000 square feet. That's why we invested 700 crore here in India, across India. That's why we have 3 sites. We have Chennai for business backhouse. We have Pune for manufacturing. We have Bangalore for software and AI. I mean, this is the opportunity and the growth plus our investments, I think, come together for the next decade in an amazing way, for the next 100 years, not just decade.
Thank you so much, Shez. This was a very interesting conversation. And with that, we come to the end of the episode. Thank you.
It was a pleasure. Thanks for